Otitis media is the infection of the middle ear caused by bacteria or virus. Today on Sound Health, we are treating the condition. I'm Olasumbo Modupe. Welcome to the show. It's still Sound Health on Lagos Television, and today we are looking at a type of upper respiratory tract infection. It's called Otitis Media, and Dr. Ukeje Johnson, a consultant ENT surgeon, will diagnose the topic. Welcome to the show, Doctor.
Thank you. Thank you for having me. Good day, Lagos State. Good day, Nigeria.
Okay, we need to enlighten members of the public. What is Otitis Media?
Otitis media is an infection or an ailment affecting the ear, particularly the middle ear. Because we know that the ear is divided into three parts: the outer ear, the middle ear, and the inner ear. So otitis media is that ailment that affects primarily the middle ear. The infection or the issue can spread to the other parts of the ear, but primarily it affects the middle ear.
All right, doctor, what causes the condition in people?
Okay, there are a lot of causes of otitis media, but I will pick out those ones that particularly pertains to our environment, and then I will try to bring up issues of age to categorize it, because most of the ones we are more concerned with that affects children, particularly below 5 years of age, and more especially children who are below 1 year, that's infants. The primary cause is as a fallout of upper respiratory tract infection, like common cold, cough. So most children, when they have this issue, it can easily spread, because the relationship between the middle ear and the respiratory tract is very close. So most times that infection in that respiratory tract can easily spread to the middle ear. So
if not treated properly?
Yes, not treated properly. So that's the primary cause of otitis media in our environment. Also added to that is pollution. A lot of pollutants are in the air that predispose the child to having that upper respiratory tract infection, which can easily now spread to the middle ear and cause the issue. Also, we have had issues of children, particularly those who are still breastfeeding, poor breastfeeding pattern in mothers, because we also advocate the fact that there's an appropriate breastfeeding position for a mother. You sit up and breastfeed your baby, but most mothers prefer to lie down. So those can actually make the breast milk to flow into the middle ear and block, and then the child will be predisposed to having otitis media.
Okay. Is it a life-threatening condition?
There are ones that are caused by mild pyogenic bacteria. What I mean by pyogenic, bacteria that forms pus, that makes the body to start forming pus. And there are ones we call necrotizing. That one is the infection can spread even to the skull base and to the brain. So in that regard, it could be life-threatening, especially for a small baby. So in that regard, yes, those that are being caused by necrotizing infection, more especially children who live in overcrowded environment and poor ventilation, we can have life-threatening issues from there.
What are the symptoms and how do you diagnose the condition?
For older patients, I'm talking about above 5 years, above teenagers, adults, we also have issues that can predispose to otitis media, what we call sinusitis. These are inflammation or allergy of the nose and paranasal sinuses. So that is a neighbor to the ear. So infection can also spread from those sinuses to the middle ear and give rise to otitis media. Also, most tumors you find in the upper head and neck can also predispose to. That's also what we call adenoid that you see in children between 1 year, 2 years to 5 years, can also predispose to otitis media. So for adults, I'm talking about above 20, you talk about sinusitis, you talk about tumor. For children above 5 years, 2 to 5 years, you talk about adenoids and tonsils.
Okay. Earlier on, you pointed out that otitis media affects older people. Can you please shed more light on that?
Primarily, is a diagnosis you can make in the clinic. What I mean by that is, a patient comes to the office to consult a doctor, and the questions you ask can actually it's a pointer to the otitis media. So we use clinically, and then examination, then investigation. For history, when you're asking the patient a question, the primary thing for a child is irritability, because the child cannot tell you what the problem is. So the child is irritable, crying. That's one. Then 2, fever. It's also a pointer that something is happening in the middle ear. Also pain, localized pain. The mother will always tell you, when I bath this child and touch the ear, the child screams. Irritability increases. It's also a pointer that there's something happening in that middle ear. Also, other general ailments, vomiting, refusal to eat, poor sleep. But those 3 cardinal points, irritability, fever, and pain in the ear, is a pointer. So now when we now examine the ear, we now see the features, changes in the middle ear. That's also a pointer. Then investigation, if there is pus or discharge already coming out, so we take a swab of that and send for microscopic culture and sensitivity. That's the way we make a diagnosis.
Okay. Could otitis media be hereditary?
It cannot be transferred that way. It's just like I said before, recurrent upper tract infection, poor breastfeeding pattern of a mother, then poor ventilation, overcrowding can predispose to that. But there are other issues we have seen, emerging issues we've seen. Patients who have congenital anomalies like Down syndrome, Yes, we know that Down syndrome can actually be congenital in a family. So in that regard, in that light, because children who have Down syndrome are predisposed to having otitis media.
Is otitis media infectious? Can I get it from someone experiencing the condition?
In that regard, no. Because there are some diseases or ailments that we know that can easily be transferred to other patients, like tuberculosis. So no, it's not. Because it's a localized infection in the ear. In that regard, it is a localized and it cannot be transferred to somebody else.
What is the difference between otitis media and perforated eardrum?
I will try to classify otitis media. We broadly classify it into 3 types. We have suppurative. What that means is that pus forming. We have non-suppurative, means pus is not being formed. There's no discharge. Then we have what we call specific otitis media. So we have 3 broad types. We have the suppurative, that means pus forming, there is a discharge. Then we have non-suppurative. The person has otitis media but no pus is being formed. Then we have the 3rd one, specific. Now these specific ones are being caused by specific organisms like syphilis, like tuberculosis. So that's why we call it specific. Something is causing it. Now the other suppurative and non-suppurative. So the one that is pus forming is what we call suppurative. That means the eardrum is perforated. So most of those cases starts with non-suppurative. There's no discharge. If it's not well treated, the eardrum perforates, then the discharge now start coming. Now call it suppurative otitis media.
Are there other health conditions related to otitis media? You made mention of Down syndrome, yes, syphilis. Yes. Are there other health conditions?
Yes. I will always want to pick it up from children because that's our main concern. You give the children a brighter future. So for children, the issue we talked about adenoid and tonsils, because those are structures that are very close to the middle ear. So a child that is having adenoid and tonsils, which most times present itself as snoring, nasal discharge, and poor sleep. So because most people in our environment doesn't think what we call catarrh or nasal discharge as a problem. So those are the telltale signs that the child is most likely having adenoid. So if it's not now well treated, it will now cause otitis media. Then for older patients, like 10 years, 20 years and above, we're not talking about the sinusitis. And of course, we can't forget recurrent upper respiratory tract infection, your common cold. Those are the things that most times predispose patients to having otitis media.
Can otitis media lead to hearing loss in person having the condition?
It can, because we're talking about the middle ear, where you have the normal pattern of hearing. This is the pinna. So yes. So sound waves are being collected by this pinna, which directs the sound to the external auditory canal, which is between here and here. So that's the sound moves. Then that is your eardrum, tympanic membrane. So the sound now vibrates this tympanic membrane, which sets in motion vibration of the ossicles. There are 3 of them: malleus, incus, and stapes. So the sound waves hits the tympanic membrane, it vibrates, then sets up vibration on these ossicles, which moves and stimulates the inner ear, the cochlear nerve. So if for any reason, because that's what the otitis media does, it destroys this bone, because there must be that vibration of these bones for an individual to hear. So for any reason, these ossicles, these bones are destroyed. They can be dislocated, they can become stiff, because there are joints in between them. So from dislocation to stiffness to even necrosis. So there's that void, no communication between now the external ear and the inner ear, because that is the communication. So for any reason this sound could not get there, it can go to the hearing loss. That's 1. Then 2, for eardrum that has perforated, it cannot vibrate normally. And then that vibration in the ossicles cannot be set up. So the individual will now have problem with hearing. Now for children also, I mentioned again, for a child between 1, 2, 3 that cannot hear, that child cannot acquire speech, that child cannot acquire language, that child will have issues with learning. So that's why issues we in ENT are more particular about children, especially people below 1 year. Because most times when the thing is not treated, we see them when they are already postlingual, that's when they should have acquired speech and they've not acquired speech. That's when we now start talking about hearing and all that. But if you can get them early and treat it well, there will be no hearing loss, the child will speak well, and the child will acquire language, and the child will do well in school.
How do you treat otitis media? Is it treatable?
Yes, very, very treatable. Provided we see the patient, like I mentioned earlier, when the hearing has not been impeded upon. We talk about treatment. First, you have to make a diagnosis. And we've talked about how to make diagnosis. So after diagnosis, we now try to rule out other things that may have caused the otitis media. So basically, we may use antibiotics, provided the causative agent has been ruled out. So the most antibiotics we use are amoxicillin and amoxicillin carbonic acid, because most of the organisms that causes it are streptococcus in our environment. So, and they respond well to the antibiotics. That's one. Then two, when we pick the pus, if it's suppurative otitis media, the microscopy that comes back can also guide us to the particular antibiotics to use. We also use analgesics because, like I mentioned, the child is having pyrexia, fever, and it's irritable. So we also use that. Then we also use other antihistamines, like I talked about, allergens that we also use to treat. So basically, we now talk about medical and surgical options to treatment of otitis media. So medical is what I just mentioned now, the antibiotics, analgesics, and antihistamines. Then for surgical, is basically to rule out or to eliminate the tumors I mentioned about, particularly adenoids. So we can actually use surgical way of treating to treat otitis media. Then we also use counseling. For mothers, we counsel them. Now it's interesting to note that there's a brief study we did. We looked at children below 1 year that had otitis media. We found out that 70% of them their mothers actually came for antenatal and they were not told about proper breastfeeding pattern. 70% of the mothers attended antenatal. So it's actually an eye-opener that we should intensify efforts in telling mothers when they come for antenatal how to breastfeed their children. Because most things we do these days is preventive medicine. So that also helps a lot. So we counsel, then we now do medical, or we can now do surgical. Okay.
This is where we say thank you to you for sharing your expertise with us on how to manage otitis media on Sound Health.
Thank you once again. Thank you for having me. It's been a pleasure. Thank you.
That has been Dr. Ukeje Johnson, consultant ENT surgeon, diagnosing otitis media and how it can be treated. Sound Health continues with trending and home essentials. Please stay with us. Consultant ENT surgeon advised that early medical help could check hearing loss caused by otitis media. That's it on Sound Health this week. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social. #Sound Health. A sound health is a sound mind. Make healthy living your choice.